The aim of this video is to talk to you about the immunotherapy treatment that you are going to be receiving. I will explain what it is and the potential side effects that you may experience whilst you are having treatment, and will be sharing important information with you about the risks of the treatment and what you must do if you become unwell. Immunotherapy is a relatively new set of drugs developed in the last few years. Cancer cells have developed the means to switch off the immune system's ability to recognise cancer cells and destroy them. Immunotherapy has been developed to switch the immune system back on. In doing so, targets cancer cells for destruction. This will also be discussed further in detail when you attend your pre-immunotherapy consultation with the nurse. It is also an opportunity for you to ask any questions that you may have after watching this video, so please write them down and bring them with you. You will also be provided with an immunotherapy alert card, which contains the 24-hour emergency helpline. It is important that you carry it with you at all times, and bring it with you if you are asked to attend A&E. Your oncology consultant will discuss with you the reason for your immunotherapy. If you have any further questions, this could be addressed in your pre-immunotherapy consultation. However, if the nurse is not able to answer them, you may need to go back to clinic to see the doctor, who will clarify the need for immunotherapy. The frequency of your treatment can vary from 2 weekly to 3 weekly to 6 weekly. It depends on the type of your cancer and the regime that we are using. Some patients are offered a combination of chemotherapy and immunotherapy treatment. Please refer to our pre-chemotherapy chat video if you have been offered combination treatment. You may be asking what you can do before you come for your treatment. Please ensure that you eat and drink as normal prior to coming for your treatment. We do provide tea, coffee and cold refreshments, as well as biscuits and also sandwiches at lunchtime. But it is really important that you are well hydrated, especially if we need to access your veins. When you arrive to have your treatment, please book in at the reception desk and take a seat. Car parking is concessionary, and you will only have to pay £1 for each visit. So please speak with your nurse about how this can be applied. After arriving, a healthcare assistant will take you to your chair and take your temperature and blood pressure, and also your height and weight. You will need to confirm your name and date of birth, and a wristband will be put on during the duration of your treatment. During your first appointment, the nurse looking after you will confirm your consent and address, and any concerns or questions you have before proceeding. The nurse will also ask you a few questions to assess your fitness prior to proceeding with the treatment. If you are well, the treatment will be administered to you. This is done each time you attend for immunotherapy. A cannula will be put into the back of your hand or your arm, and you will be connected to a drip. This will be removed before you leave the department. Before each of your treatment appointments, you will need to have a blood test, which can either be done at your GP practice or your local hospital phlebotomy department. These will need to be done 48 hours prior to each treatment, but this will be discussed further when you attend for your pre-chemotherapy consultation with the nurse. It is important to have your blood test done in the morning between 8 AM and 10 AM, as it gives us a true reflection of the blood results, and is particularly important for immunotherapy. This is because one of the blood tests is most accurate in this time frame. Firstly, we will talk about side effects that you may experience while having the treatment on the unit. One of the risks when you receive any drug is the potential to have an allergic reaction. We will have established prior to your treatment if you have any allergies and what those are. If you have any allergies, you will have a red wristband instead of the standard white band. There may be a small risk that you react to the immunotherapy. If this happens, you will usually experience some immediate effects. Some symptoms of a reaction include a rash, suddenly feeling unwell, flushed, shivery or short of breath. If you feel any different to how you did prior to your treatment or experience any of those symptoms, let your nurse know immediately. The nurses are experienced in spotting and dealing with reactions and will give you treatment to reverse the reaction quickly. Your treatment will be stopped until it is safe to restart your therapy, depending on your reaction. Very occasionally, the treatment can leak out of the vein into the surrounding tissue. It is important that you inform the nurse straight away. If you notice this or have any pain, stinging, redness or swelling around the vein. After your treatment is completed, you receive an appointment for the next cycle of treatment, and you should expect to receive an appointment for review by a doctor or myself prior to next treatment. This may be a clinic appointment or a review on the telephone. Now I will discuss the side effects that you may experience after you leave the unit. Side effects can happen and develop when the immune system starts to develop an autoimmune response to a particular organ in the body. This means that the immune system starts to attack the body itself. This may be the skin or the liver or the bowel, in fact any organ in the body. This means that the organ becomes inflamed, leading to certain symptoms. Side effects can vary from person to person. Some people may have no side effects, or some may have one or two. The most common side effects that you can experience from immunotherapy are diarrhea or constipation, a rash, itching, breathlessness or increased breathlessness if you already experienced this from your cancer, aching joints and swelling muscle aches, and tiredness. If you experience these symptoms, it is important that you let us know as soon as possible via the chemotherapy helpline number on your card. To help look after yourself, it is important that you eat small, regular meals with snacks in between. Drink plenty of fluids. This can be water, but also tea, coffee, juices or squash. Just remember, if you drink a lot of caffeinated drinks, they can dehydrate you. So replace the equivalent cup of caffeine drink with a drink of water to prevent dehydration. When you have received treatment, the immunotherapy can come out in your bodily secretions. So if you or family members are handling any bodily fluids like urine or vomit after you have received immunotherapy, we advise that gloves are worn. Any sheets or clothing contaminated should be washed on its own a couple of times on the highest setting. You should not get pregnant or get someone pregnant whilst you're on immunotherapy, as this can be harmful to the developing embryo. So contraception must be used when having sexual intercourse. A common question is regarding flu vaccination. If you are having chemotherapy and immunotherapy, you should have the vaccination a couple of days prior to having your treatment. If you are only having immunotherapy, you may have the flu vaccination at any point. Good hand hygiene is strongly advised when having treatment. So wash your hands often, especially before eating. Wear gloves if you are gardening to minimise any risks. Over-the-counter alcohol gels are good items to have in your bag when you're out and about. I have discussed the various common side effects of immunotherapy in brief. I hope this has been useful for you and your carer and family. As we said, please make a list of questions that you may have, and this can be discussed with the nurse during your pre-immunotherapy chat. Thank you.